and thanks for joining me on this webinar, which will talk about training for healthy living pharmacy. I'm Hina Joshi and I'm the lead for HLP, and I support members by building up all the materials and the resources to make the journey a little bit simpler in terms of getting yourself accredited as a HLP. So in this short 15-minute webinar, I'll be covering the details around what training needs to be completed in order to achieve HLP status. So just looking at what I'll be covering, I'll do a short introduction in terms of what healthy living pharmacy is, or HLP for short. I'll touch on the HLP framework, explain the training to be completed and where to access this from, breaking down the roles and responsibilities that support HLP and how that training fits into the bigger picture, a little bit about collating your evidence folder, and finally set out the next steps. So hopefully it'll give you some clarity and give you some direction on what to do next. If you haven't already done so, do have a look at the Simple Steps to HLP webinar, which will essentially provide a really good breakdown of the steps to follow to achieve HLP status. And you can actually watch this webinar by visiting the link that's on screen right now. Alternatively, the Simple Steps to HLP webinar is available in a leaflet format, so if you'd rather have the details in a simple process on paper, just take a look at the link on screen, and this is where you can download the leaflet from our website. We've also got a library full of resources, guides, blank templates to use as part of building up your evidence portfolio. So if you do require additional support, just get straight in touch with me. I'll leave my details towards the end of the webinar. So I just thought I'd give you an introduction to healthy living pharmacy and what it actually is. So essentially, a healthy living pharmacy is a pharmacy that's committed to support the health and well-being of the community and put them at the heart of what they do. So it's about displaying proactive behaviour, and it's crucial that the pharmacy team work together to offer this to support their community. This can be done in a number of ways, from you offering brief advice that lasts say a couple of minutes long, to delivering a service that would support a person to actually change their behaviour towards their own health and well-being, and even taking that outside and wider to providing services to local community organisations. So, as you're probably already aware, the pharmacy industry is switching its focus from dispensing to increasing service provision, especially with the new pharmacy contract. And so healthy living pharmacy is a great way to introduce the services you offer, or even introduce brand new services, by having that proactive team behind you that actually supports the community, recognise the availability of services, and also long term it will improve the health outcomes of the community and reduce health inequalities. So you may already be aware from the Simple Steps to HLP webinar that I do talk about the HLP Framework, which is a document that sets out the requirements to be met by the pharmacy in order to gain HLP status. There's 3 enablers that are discussed in the framework, which are based around developing your workforce or your team. It's about engaging with your local organisations to bring out HLP and also showcase what services that you offer in your pharmacy, and the environment, relating towards what you need to have in place in your pharmacy. So this is in relation to your health campaigns and your consultation room. So essentially the training that I'm going to be talking about in this webinar falls under the workforce development enabler, and it's all about developing a skilled team to support the healthy living ethos, and it's by being proactive and supporting behaviour change to improve the health and well-being of your local community. So to feel the real benefits of HLP, it's important to engage the whole team. So you need to bring them on board and share the journey with them quite earlier on in the process. And I just want to highlight as well that we've got plenty of resources available in the form of guides, blank templates that I've already mentioned. You can access these and use them to support your HLP journey. So in the blue box there, you'll see I've put in a link that I shared in regards to the 3 enablers that I've mentioned, so you can actually download some really great resources for each element in order to compile your evidence portfolio. But just a note, really. The list of resources that we have on each page isn't an entire list to meet every single requirement from the framework. It's a guide, and so you should be providing evidence that's tailored to your own pharmacy. So what training do you need to do to achieve HLP status? According to the HLP framework, it states that you have a person that's undergone some leadership training and is therefore a health and wellbeing leader, and a full-time equivalent member of staff that has completed the course and assessment and therefore become an accredited health champion. The course itself is an RSPH qualification, and that person will complete that course, and there's an assessment at the end, which I'll explain about in a moment. Let's just delve into the health and wellbeing leader role. So, as mentioned, the training is to be completed by a pharmacist or a pharmacy manager. Ideally, though, the training would suit a person that has management or supervisory responsibility. So it could be someone that has been working in a leadership role for quite some time, but it would suit anybody really that's new to leadership, and therefore I think it could be a great step up for a technician that is entering into the management world. So the role will essentially bring the team together. You'll be leading by engaging them to HLP, motivating them to adopt the HLP ethos, whilst also managing change, as HLP is a different way of working. Now, the actual framework runs through a set of domains or areas that I've listed on the screen there that leadership training should cover. But essentially, the course will need to cover things to develop that person, to support skill mixes within the team and support that transition, especially as HLP, as I've mentioned, is a different way of working. The Newmark have developed a leadership course that is available on the Newmark Training Library. It's mapped to the HLP framework, and it's available free of charge to our members. The course will roughly take 2 to 3 hours to complete, and you will be able to download and print off a certificate as well for your evidence portfolio. So to access the course, you will need to register on Newmark.net, and there are full details on how to actually do this that's available on the link that I've shared on screen. Essentially, the actual course covers topics such as communication, delegation, time management, developing your team, change management, amongst other topics as well that we will be covering, but also it will focus on incorporating the HLP element of it and bringing that in as well. So we'll also talk about the HLP support that's available for you as well. Delving into the requirement for the health champion training and where to access this, there needs to be a full-time equivalent member of the pharmacy team that is in a patient-facing role, and they've completed and successfully passed the assessment for the Champions course. This, as I mentioned, it's a qualification by the Royal Society of Public Health, or the RSPH. So the course that will be completed is the Level 2 Award in Understanding Health Improvement. Now, we've partnered with Buttercups to provide that particular course, which comes at a small cost. There's also a separate fee for the assessment, which is delivered by the RSPH rather than Buttercups. Now, the assessment consists of a set of questions and multiple choice answers. So the exam will be invigilated by a registered healthcare professional, and the member of staff taking the course will be given 45 minutes to complete the assessment under exam conditions. Once the assessment has been completed, the paper will need to be posted back to Buttercups, and then they will forward that onto the RSPH to mark that paper. Usual turnaround is around 2 to 3 weeks to receive that certificate back. So do bear it in mind really when you're going through your HLP journey. And once you get that certificate, you can store that within your HLP portfolio. Now, I mentioned the course is available from Buttercups. So as a Newmark member, you will actually benefit from a 10% discount from the online course. To book, simply call or visit Buttercups' website. The details are on screen. Ask them or search for the Level 2 award in Understanding Health Improvement, and just ensure that you let them know that you are a Newmark member to get that discount. But in essence, the HLP champion role is the actual benchmark. It's a gold standard which is required for HLP, and having a qualified member of staff in this role will play a huge role with engaging with the community, the public as well, to provide them with that brief advice on health and wellbeing. They'll essentially set up and maintain a health promotion zone, and they'll also signpost people to other providers to access advice or services. Now, to help you select the right person for the health champion role, you can actually download a role specification from NewmarkNet, and that's going to give you a really good overview of the role and the requirements. So as part of the health champions role, there is the setting up and maintaining of the health promotion zone. So health promotions are a key role in HLP. They're designed to encourage people to think about making better choices with their health and wellbeing. So as a champion, you can access our health promotion library to get lots of ideas to running effective campaigns. And once you've got a few of these under your belt, it will be highly rewarding. People will start to take notice of your changing displays. So try to make them impactful, eye-catching. You might want to add images and visual props if you feel it's appropriate. But in terms of your messaging, try and keep it quite simple and clear, and don't forget to include some takeaway resources. But if you want some ideas setting up your health promotion zone from scratch, we've got a handy guide to kind of help you with building your health promotion zone. So you can get that from NewmarkNet. We've got an abundance of health promotion materials, including video guides, health promotion briefing sheets available on different topics, and we've also got a interactive calendar that's packed full of national awareness events that's linked to lots of other support that Newmark can help with. So now you know about the roles of the leader and the champion. I thought it'd be useful to summarise this in the table. So you can see on screen, this looks at the different roles and the responsibilities for the health and wellbeing leader, the health champion, and the whole pharmacy team. So in summary, the health and wellbeing role is about bringing your staff on board. It's about embracing the HLP ethos, supporting the change in ways of working. And a top tip for leaders is to start with a team meeting. Set out clear expectations right from the beginning, but it's also about involving the team to think about new ideas and how to be proactive. So to facilitate the conversation on HLP and engage in the whole team, we've got a presentation slide deck that's available on NewmarkNet, and you can simply download that and use that as your presentation. The leader will also develop an action plan to fill in the missing gaps to what you still need to do in terms of meeting the requirements as set out in the HLP framework. So use that framework as your guide to help you establish what you need to do next. As a leader as well, they'll be taking part in gathering evidence and collating that into a folder. In terms of the health champion role, you saw in the previous slide, they will essentially lead on the campaign front. They'll engage externally, and they'll take HLP out into the community, and they'll support people by having proactive conversations. And it's all about making every contact count. Champions will also support the team to engage with campaigns, complete any relevant training that's needed, and also play a part in collating that evidence, and also keeping that evidence up to date. Champions will essentially help in the recruitment of services as well. So it's really important to bring the whole team on the journey. It's not just about the leader and the champion doing everything. So looking at the responsibilities of the whole pharmacy team, they will essentially support by having proactive conversations with customers, supporting the campaigns, and also play a really vital role in supporting to recruit into services, including any engagement activities that you do, and essentially, you know, reducing those health inequalities. So, as you've heard, it's pretty important to have a team support the whole overall goal of achieving HLP status. And I just want to let you know as well that we've got all the tools available that can really bring everyone onto the journey. That includes developing a vision statement for HLP as a team. You could also conduct a SWOT analysis as well, all of which they are blank templates available for you to use and use as part of your evidence collation. Remember though, as I mentioned, the resources that I've talked about are suggested pieces of evidence you can use, but if you've got any other evidence to support, feel free to use it. So we've mentioned that evidence is everything in relation to the HLP framework. Just ensure that you do try and save everything into a single ring binder folder in a clear, concise and logical order. Keep it up to date with any campaigns that you deliver, including any outreach activity delivered and any training that everybody does. This is really important because if you are chosen to be inspected, this is what they'll want to see. So you need to have that awareness of your materials, of all the activity that you've done. So as mentioned as well, you can actually download the set of templates that I've already spoken to you about. So there's the templates that I've already mentioned, but there's many more other templates that you can use and pop them into your own folder. Alternatively, we've got a professional looking folder that you can actually purchase from Newmark's eShop at £30, excluding VAT, and that contains all the resources and all the blank templates printed out, and they're set out in a really logical, clear manner. So you can see a link on screen as well if you wish to either download the templates and make your own folder or purchase the folder from the eShop. So in terms of the next steps, I thought I'd just sort of wrap up what to do next. So if you haven't already, watch the Simple Steps to HLP webinar. That will really break down the journey for you. And if you don't want to watch a webinar and you prefer it in a paper format, then you can download that as well from Newmark.net. Also, take a look at the HLP framework. That is your guide, as I say. So from that, you can have a look at the list of the requirements, which, by the way, you might already be meeting them. It's just you might just be missing that evidence. So what you can do is, from reading that HLP framework, you can start to develop an action plan, and you can get a copy of that off Newmark.net. Do select the appropriate person that needs to complete the training that we've already spoken about. So that's a leader and also the champion training. And also refer back to that action plan as well to determine what you need to actually do next. So that brings us to the end of this webinar. I really hope you found it beneficial, and it's hopefully instilled some confidence in you in terms of what you need to do now with HLP. But if you do have any questions, please just get in touch with me directly. My details are on screen. And I just want to say thank you so much for joining me on this webinar, and good luck with your